Good. How are you?
Good.
It is, isn't it? Wiggly worm.
Well, good morning. Today we're here to announce an unprecedented partnership, one that will bolster our efforts to address the opioid epidemic, one that's plagued our community and our country. It's really taken a devastating toll. Last year, 449 people died of an overdose in St. Louis County. Now, that's an 11% decrease from 2021, but it's the third highest number in the past 5 years. So to put that in context, more people died of an opioid overdose in the last year than died from homicides in the last 2 years put together in St. Louis County. So while we're glad to see the decrease in overdose deaths, 1 year does not make a trend. We must continue to work to break up the stigma around overdose, around substance abuse, and we must do everything we can in our efforts to increase harm reduction. One of the best tools we have for that is naloxone, and that is a medication commonly known by its brand name Narcan. And over the past few years, we've increased access to Narcan in St. Louis County. We've offered it for free, no questions asked, in all three of our health department clinics in St. Louis County, 2 in North County and 1 in Sunset Hills. We've started providing Narcan for free at 5 of our St. Louis County library locations, including this branch here, where we started our pilot program. We provide Narcan free through our jail to our residents who are being released from jail. So today we're pleased to announce that the St. Louis County Library will begin distributing Narcan at all 20 of their locations. And we're making that announcement here at this branch because this is one of the zip codes in St. Louis County where opioid deaths are the greatest. And we're making this announcement on International Opioid Awareness Day. And it's the world's largest annual campaign to raise awareness about opioids, about recognize and remember folks who have died from an overdose, and also to recognize the grief of family members and friends who've been left behind. And I'm here today because this is one of my priorities as a doctor, as a parent, and as the leader of St. Louis County. When I was on the county council in 2016, I sponsored and passed legislation to create the prescription drug monitoring program in St. Louis County. That program was the first in Missouri. It spread across the state as other counties and municipalities have subscribed to our program. It's a program that helps make sure that folks that are struggling from addiction don't have easy access to prescription opioids. So I'm pleased to be here today with Dr. Kanika Cunningham, the director of the St. Louis County Department of Public Health, and Kristen Sorth the director of our St. Louis County Library system. And we'll hear from him in a few minutes as they'll make some comments too. Last year, I announced that St. Louis County would receive a $45 million settlement in litigation against opioid manufacturers and opioid distribution companies. We've already received our first payment of $5.9 million, and the rest of that settlement will come over the remaining years in payments of several $1 million each year. As we get more details of those funds coming into the community and how we might put them to use, we'll be talking about that again and engaging the community. So now I'd like to turn the podium over to Dr. Cunningham, the director of our County Health Department.
Good morning. Thank you all for coming out this morning to learn more about our commitment to address substance use disorder and reduce drug overdoses. I want to especially thank Dr. Page for his leadership and support in this area. I also want to recognize the vision of our partner, Kristen Sword, director of the St. Louis County Library and a faithful partner to DPH. We are thrilled to be able to build upon the community trust that the library has earned in order to save lives. We also thank Kristen for hosting us here today. As Dr. Page mentioned, we have seen an 11% reduction in drug-involved overdose deaths in the county last year compared to the previous year. But I also want to echo his message that the fight is far from over. 449 people died from drug overdoses in St. Louis County, and that is only 52 less deaths in 2021. Every one of those deaths were preventable. Each of those losses represent a death of a loved one. Each individual taken by an overdose leaves wounded family members, friends, and a traumatized community. Our family and friends are not statistics. Excuse me. They are human beings who deserve to be respected and valued in our community. It's important also to note that disparities remain in drug-involved mortality. Black men die at a rate of 2.5 times higher than the next closest demographic group. In 2022, Black residents of St. Louis County visited the hospital for non-fatal opioid overdoses 3.4 times higher than white residents. Lastly, over the last 5 years, Black children less than 15 years old accounted for 74% of the deaths in the youngest age group. So there's much more work for us to do. This new partnership with St. Louis County Library is an important part of relationship building, which expands access to life-saving drug naloxone or Narcan. I am pleased to report that we have distributed 1,054 doses of Narcan to the public so far this year. We already surpassed last year's total. Additionally, we are distributing Narcan to residents of St. Louis County Correctional Center, as Dr. Page mentioned. And lastly, we are taking steps to have Narcan available on any DPH employee who serve the community. I want to highlight two other areas that are a passion of mine: stigma and harm reduction. First, it's imperative to reduce the stigma, bias, and shame associated with substance use. Stigma is one of the biggest barriers to preventing overdose deaths. The stigma prevents many individuals from seeking care and having access to life-saving medications and information. Countless deaths may be prevented by eliminating the stigma. People who use drugs should feel safe and welcomed by our community and healthcare systems. Secondly, I want to echo harm reduction principles, as Dr. Page mentioned. It's important to realize that harm reduction is not about promoting illegal or harmful activity. It's about reducing the negative consequences of drug use without requiring abstinence. Substance use disorder is a complex medical disease, and harm reduction values every individual and truly meets anyone where they are. It provides a path to recovery, from preventing health-related risks to IV drug use to restoring hope. Our message then is simple: there is hope. As Dr. Page mentioned, we have created and updated a substance use action plan that details these and other strategies we are using to end overdoses. This plan calls for us to deepen our partnerships to address substance use disorders, and today's announcement is an exciting example of how we are reaching that goal. Another part of that action plan is our campaign to promote Narcan in the community. Its theme is Anyone Can. I want to remind everyone that any county resident may order Narcan from any DPH clinic by clicking on the QR code behind us or by contacting DPH directly. And now please welcome Kristen Sorth, Director of St. Louis County Library.
Good morning. I'm Kristen Sorth, and I'm the Director of the St. Louis County Library, and we are so thankful to be working with our partners at the St. Louis County Department of Public Health to offer Narcan kits at 5 of our branches. Those branches are Lewis and Clark, Florissant Valley, Weber Road, Rock Road, and Natural Bridge. We are also pleased to announce with everyone up here that Narcan kits will be available at all of our branches in the very near future as well. Thank you to Dr. Page and Dr. Cunningham for their continued support and their amazing partnership with the library. The library has worked with St. Louis County government on many successful initiatives over the last few years, and particularly during the pandemic, including digital equity for older adults and children, COVID-19 testing and vaccines, rental assistance, and services for the justice involved. Now we are teaming up to help prevent opioid overdoses. Libraries have become the center of the communities we serve. Through partnerships such as this one with the St. Louis County Department of Public Health, we are able to provide critical resources to individuals and families. Narcan kits are an important addition to the other range of services we provide at our branches. In addition to our essential role of supporting literacy in our community, St. Louis County Library also provides job help, access to technology, both virtual and in-person programs covering topics from stress management to yoga, language and citizenship classes, notary services, and so much more. And in partnership with Operation Food Search and the St. Louis Area Diaper Bank, several of our branches, including this one, offer diapers, period supplies, and meals for kids. This year, we also added social workers at 5 of our branches. Since the program launched in late June, library social workers have served over 200 individuals, helping them with issues around food insecurity, housing, childcare, mental health, substance abuse, and addiction. Individuals can fill out a Book a Social Worker form on our website or visit one of the 5 branches with a social worker, which also happens to be the branches that currently have Narcan kits available. The social workers will assist individuals at our other 16 branches as well, and you do not need to have a library card to receive assistance. Dr. Cunningham talked about removing the stigma of substance abuse and meeting people where they are. Making Narcan kits available at the library brings us closer to those goals. Libraries are a trusted and safe space. People come to the library for answers and assistance, and our amazing employees are there for the community every single day. Individuals who need a kit can request one with no questions asked. While library employees will not administer the Narcan, the library social workers that I mentioned earlier are trained and authorized to administer the drug in the event of an opioid overdose. St. Louis County Library has become a comprehensive solution for a variety of important resources and services in our community. Making Narcan kits available will further strengthen our support for the communities we serve. By working together, we can save lives. Now I'm going to turn it back over to Dr. Page.
We'll do a little shuffle here. Okay, before we open this up to questions, I just want to make one announcement that the St. Louis County Department of Health provides training on the use of Narcan, and we're certainly interested in working with our community partners. If your organization wants to be involved in distributing Narcan to the community or is interested in training, then give us a call at the Department of Public Health at 615-0600, 615-0600. That's area code 314-615-0600 if you're interested in partnering with us in Narcan distribution with your organization. And I would be glad to answer any questions.
I
Yes?
have a question for Ms. Sork. You said near future. How, like, what does that mean exactly?
Probably in the next month or so, that'll be at the rest of our branches, definitely by the end of the year.
So the question is about when the Narcan will be available at the other
Right.
branches of St. Louis County Library. and Kristen said that would be within the next month. Right?
I also have a question from Ms. Swartz
Come on up here with the
about
microphone.
libraries, and you sort of touched on this a little bit, but can you talk a little bit more about why libraries and not another place? It seems like these places have become really a nexus for a lot of social outreach and public health even. And so what makes libraries unique as opposed to putting this in, a grocery store or something?
Well, I think we are a source of information and ideas and access, and people come here, like I mentioned, looking for answers and solutions to all kinds of things, and we try and respond to the needs of the community, and when they tell us they need something, we try and respond, and so we really have become a center of community in all of our branches all over St. Louis County, and that means offering some very traditional library services like books and summer reading club, but it also means offering things like diapers and Narcan kits. So you can come in and nobody asks you any questions. We're here to help, and our employees are amazing, and it just makes sense.
I have a question too about that. It's my understanding the expectation isn't that people will actually come in here or the other libraries and actually overdose. That might happen once in a blue moon. The idea, I think, tell me if you could elaborate on this, is this is a place people can pick these up for future use, relatives can come, etc.
That is correct, and I'll let Dr. Cunningham talk about this as well, but most overdoses actually happen in the home or with a loved one, and so having these kits on hand in your house with a family member who might have an opioid addiction or a child, that could save their life. So we just want to make sure that people have them on hand. They're free, they can come in and pick it up, and they can use it whenever they need it. Anything else, Deb?
I agree with that.
Okay.
Any other questions?
How much does this cost? I mean, I guess they're free, but where's the cost coming from to pay for this?
Well, this is paid. The question is a cost for the Narcan. This is paid for through St. Louis County government. We've paid several $100,000 for Narcan distribution to date. Do you know exactly how much we've paid for this? Nope.
$125,000 this year.
Yeah.
Just to clarify that, the $125,000 is for all your distribution efforts, not just for the library,
No, that's for Narcan purchase in St. Louis County.
for everything.
Yeah, for the free Narcan that we've been distributing. I would imagine that number will continue to grow. And we'll continue providing Narcan in the community. It's a great investment. It's a game changer. Absolutely. Not a simpler way to save someone's life from an overdose than intranasal Narcan.
I have a question. I know that we've seen a lot of these initiatives from St. Louis County and also other governments and nonprofits to sort of flood the community with Narcan. Is there any indication that people are using it? I know that we've seen deaths sort of level off. Can we attribute that to Narcan?
So the question is about what does the Narcan use mean, I guess, and can we demonstrate that it's making a difference, perhaps? We can certainly get more accurate statistics in the community, and I'm sure they're available, and I'll ask Dr. Cunningham to comment. But we know that overdose deaths are going down in St. Louis County, and we're a leader in the state in that regard, and that we're doing some things well, and we need to do more of that, and we need to do more to get the Narcan, get the opioid deaths down. Narcan is a big part of that, but there's a lot of other pieces to the substance abuse plan. But maybe Dr. Cunningham is available with some of the statistics.
Don't know the exact statistics, Sarah, but I will say I agree with Dr. Page. It's only one component. I think right now you have a lot of community partners who are engaged in this work, grassroots organizations who's really talking about harm reduction principles and strategies at reducing the negative consequences of drug use. You have a lot of your hospital systems who are now on board with helping individuals, connecting them to care. So I think it's a complex discussion to have, and naloxone is one part of it, but there's so many other parts to address the overdoses. And I think one thing in St. Louis County, again, is the community effort, the community lift, and again, addressing the stigma and reducing the harms associated with substance use. We're doing a pretty decent job in St. Louis County.
Final question, sorry. Is this going to be like behind a counter? Is it going to be in like a locker? Like how do people actually ask for it? Do they just ask?
Okay, so the question is about the logistics of picking up a Narcan at a county library, and I'll let Kristen answer that.
They are available, our staff has them available at the desk, and so they should just come up to the desk and they can ask for a Narcan kit and they will receive one. And they could also sign up for a library card maybe, or check out a book while they're here. But of course, they just come up to the desk and ask for a kit, just like they do with any other services.
If somebody wanted to buy one of these at a medical supply place, how much would they cost? Just out of curiosity. For a consumer,
how
in
much.
the health department.
Narcan is
Yeah, it's new that some of the pharmacies are carrying this, but for us, we hope to provide this for free.
Oh, I know that, but I just wondered what if you weren't doing this and other agencies weren't doing this, how much would people have to pay? That's
I think it's $45.
For 2 doses.
Per 2 doses. Okay, I'm looking at my team over there, so that's why I'm looking at direction. So, $48. Yes.
48. Well, I
Yep,
knew that
for
was
each
what
box.
you were paying. 48, but okay.
Yes.
Roughly.
okay. Any other questions?
How does St. Louis County compare to the other counties, or even Missouri compared to other states in terms of how widely available we're making this?
I'm sure that we're leading the state in availability of Narcan. I think we can look at our reduction in deaths from overdoses. Since this is a reversal agent for an overdose, it's something that you can change in the moment. If you have it immediately available, that's probably the best measure of wide distribution. And this is probably one of the more precise indicators of your progress in the overdose battle. I don't know what other statistic we would have on the distribution efforts. Do you know of any? No. That's a good question. But I think right now we're measuring our effectiveness by reducing the number of opioid deaths.
What's the significance of purple?
Purple is representative of the Opioid Awareness Day.
I figured
So,
'cause it's
yeah. So you notice we're wearing purple today all over the world. People are wearing purple to recognize Opioid Awareness Day and to recognize the people that we've lost. And we're going to get the message out that we're working very hard to reduce the overdose deaths in St. Louis County. And we have a very important tool to do that, and that's the availability of Narcan. Okay, thank you.